Yeah, we can call the meeting to order. Dr. Rodriguez would call the roll.
Thank you. Good afternoon, everyone. I'll go ahead and call roll. Dr. Curran,
Here.
Mr. Harper, Dr. Rodriguez, I'm here. Major General Thomas Carden, Dr. Cheek, present. Dr. Mercer,
Here.
Dr. Finn,
Present.
Mr. Walker, present. Dr. White. That's rolls have been called. I'd like to also now have an opportunity to move the minutes from the last meeting that were sent out by email last week by Ms. Vasquez. If there's any questions regarding the minutes, if not, I'd like to have some submit for approval.
So moved.
Second. Great, thank you. I have a motion. Second.
Aye.
Any opposed? Hearing none. Back to you.
Thank you. Thank you, Dr. Rodriguez. Reminds us all to use our phones when we're not talking. By the way, the minutes last month were outstanding. I read them again. They just read like a best-selling novel. It was terrific. But with that, I'd like to introduce our commissioner, Dr. Toomey.
What kind of novel it was, but it was all good. I do want to say that you'll hear if I keep talking more than about 5 minutes or less, I'm going to sound like you, Jim, as you did when you were having your talking issue. So I'm not going to talk long. I do want to say to the board members that this will be our last board meeting where we are in this room. And you can't see it, but everybody in this room is cheering. We are the last department here still in the building. And it's really been a long haul here. Believe it or not, I was commissioner back in the 90s. Well, I know I was the state epidemiologist back in the 90s when we moved into this building in the first place. Then it was such a step up from our Midtown location. And now I think we've been really anxious to see our new building. So we'll be over next to the Capitol and the Twin Towers, where we've had several meetings before. And we're really looking forward to that planned move. But it's been an enormous amount of work. And many of the ELT and others have been quite involved in this move. And I have to say, I don't think I fully appreciated, although I moved a county health department from its location across from Grady to where it is at 10 Park Place. That was very small compared to moving an entire department with all the bells and whistles that we have going on here within the department. And so I really want to give a shout out to everybody who's worked so hard on this move. And we'll continue to work on it as we make that move. But because of the move, we will not have a board meeting next month. And as we are moving, we'll be moving in and getting new equipment, etc. But we'll be meeting in the new building where we met before in July. So I look forward to that. And the other thing, there's been many changes. Both in state government, as you know, the DCH commissioner announced her upcoming resignation. In September, we'll be moving to GHA, but very surprisingly that same day, Dr. Walensky, who's head of CDC through a major part of the pandemic, also resigned, which was quite unexpected. I have a call with her and a number of my colleagues later today, and I'm looking forward to talking with her. But that, but there's a lot up in the air in terms of leadership and public health nationally. And I think we will be staying tuned to see how this all unfolds over the next months moving forward. With that in mind, I think it was important for us to just mention that the end of the pandemic emergency is coming up tomorrow, isn't it? Thursday. And I asked Dr. Rustin if he'd be willing to say a few words about what the implications are of that for us here in Georgia. We will see some changes in data collection, but really not much else in terms of access to care, but access to vaccine, access to antivirals. But I'll let him, who still has a voice, talk. So with that, take it away, Dr. Rustin.
So good afternoon, everyone. I'm going to provide just a high-level summary. I mean, there's a lot of nuances to what's ending, what's not ending, but I'm going to discuss the things that I think are most important to Georgia and public health. And so, as Dr. Toomey had mentioned, on May 11th, the public health emergency declaration will officially come to an end. When you read HHS's remarks on why they are ending this, they are basing this on current COVID-19 trends. And what they have reported that is since the peak of the Omicron surge, daily reported COVID-19 cases are down 92%. COVID-19 deaths are down by 80%, and new COVID-19 hospitalizations are down 80%. And so, as you can all imagine, that's a much different place than we were 2-3 years ago when we started this. And I think a lot of that's attributed to, we know more about the virus, obviously vaccines, therapeutics, and whatnot. So the first thing that I want to mention is that the end of this PHE, as I'm going to call it moving forward, does not mean COVID-19 is over. I think that's something that obviously is understood but needs to be said. While cases are down sharply across the country, we still see around 250 deaths per day on average across the country nationally. And in Georgia, in some cases, we see anywhere from 10 to 30 a week at sometimes. Most of these deaths are occurring in the elderly or those who are immunocompromised. And so there is still a risk and certainly still an opportunity to recommend vaccinations and prevention measures to folks at most risk to this particular virus. The ending of the PHE will not have an immediate impact on our or on the cost for vaccines and testing throughout the public health system. Quite frankly, right now in every health department, every public health district in the state, we are providing free over-the-counter COVID test kits to the public. That will continue for some time because we have bought up a large number of those kits, and we still receive funding grants that don't expire for another year or longer, that we're able to purchase these testing supplies. In addition, across the state, we have a network of PCR testing kiosks. These are available 24/7. If someone needed an actual PCR test, they can go to the kiosk, they can get a test kit, swab themselves, and then return the test kit to the kiosk, and it'll be analyzed in a laboratory. And so those will continue. And then we still have several regional sites, drive-through testing sites that are open around the state. These will be available for some time moving forward. And so there's quite a bit of options in our local health departments for the public to still access these services for free. On the treatment side, the federal government has announced that primarily Paxlovid will continue to be free of charge, as they purchased a pretty significant supply of that particular drug, and it's available still to hospitals and facilities for treatment. And so thankfully those drugs will be available to those that need it the most, and still available free, at least for the immediate future. Probably the biggest impact, as Dr. Toomey had mentioned, is on the data side. We've all gotten used to the dashboards and the immense amount of data that's reported daily in most cases. But many of these data reports and dashboards will actually end when the federal emergency ends. A lot of the data that was being reported to public health and to a CDC was because of the declaration. It was an additional data that was federally mandated. And now that mandate is ending, and I'll give you some examples of what will end. Negative test results will end. And as you know, for throughout the pandemic, we've received all test results, both positive and negative, but the negative testing results will end, which will essentially eliminates our ability to monitor positivity rates and accurate positivity rates. So the positivity percent positivity that's on the website will no longer be available. The COVID community transmission is ending. This particular metric was used primarily by healthcare settings to develop infection control plans, but we've learned a lot on how to develop infection control plans and how to prevent the virus in healthcare settings. And so thankfully those lessons will continue. But what drove the COVID community transmission was new cases per 100,000 population and the percent of positive nucleic acid tests in the last 7 days. And those results won't be reported anymore. So therefore that transmission index can't be continued. What will continue is the national reporting of aggregate weekly counts of COVID cases and associated deaths will end. However, we will continue. What will be continued to be published is hospitalization data will be available, as well as death records will be available and published using the National Death Reporting System. And it'll be reported as date of death and not date of report, which is a more accurate reflection of what's going on. Another metric that's ending is the COVID community levels. So if you go to the CDC website or even some of the public health websites, you can look up a county and it'll tell you if that county is high, medium, or low, and they color coded this. And that particular metric is ending because it relies on hospital admissions as well as percent of inpatient beds occupied in the last 7 days by COVID patients, as well as that metric, new cases per 100,000 in the last 7 days. So a lot of these metrics drive these transmission indexes, the community COVID indexes, and you'll see that a lot of this information won't be reported on our website or federally. And so that's, I would say, at least for now, the biggest impact is the amount of data that's being reported. But again, we will continue to monitor the trends based on the data that we can collect and be able to respond appropriately after May 11th. And that's the high level summary, and I'm happy to take any questions.
Thank
The
you, Dr.
bottom line, well, sorry, go ahead. I was gonna say the bottom line is that that the public will still be able to get services from us, both in terms of testing,
Yes.
access to the home tests, as well as vaccine.
Absolutely.
Thank you, Dr. Rustin. This probably be a short meeting, but it's a very important meeting. And a part of that is to find out what's going on at the legislature. Megan Andrews.
Hey, everyone. Is someone going to advance my slides? Okay, perfect. Thank you. Hey, everyone. Megan Andrews. I'm the Assistant Commissioner for Policy at DPH. Good to see you all again. I'm going to go over some of the legislation that passed this year. I'm focusing my presentation on those quote unquote direct impact bills that require us to do something as an agency, stop doing something, do something differently. So that'll be the focus of this presentation, but you do have a full session wrap up that should have been sent to you. That's some light over 50-page reading of all the legislation that passed that touches on public health or the way we operate. You can go to the next slide. So this session, we tracked 184 bills. Those are ones that directly impact us or ones just of interest to our agency, but don't require us to do anything differently. 74 of those bills were direct impact. Not all of those passed, but those were the ones that we had to watch more closely or work on throughout session. Next slide. So now I'll go into the direct impact legislation that passed, and there's a slide for each of the bills, and I'm happy to take questions at the end. You can do the next slide, Frederick. Okay, so the first one is House Bill 76. The basis of this bill was, I believe, was licensing marriage and family therapists, but through the legislative process, language was added on to abolish the Georgia Occupational Regulatory Review Council. The department does have a seat on that council. I serve on that on behalf of the department. So that council will no longer be meeting. So that is one of the direct impact bills. I'm going to move to the next slide. The next one is Pharmacy Tech Vaccine Administration. So throughout the pandemic, pharmacy techs were authorized to administer vaccines under the supervision of a pharmacist. This bill would extend that authority beyond the public health state of emergency that's ending, as Dr. Rustin talked about. So under state law now, pharmacy techs will be authorized to continue administering adult vaccines under the supervision and authority of a pharmacist. Next slide. The next one is the abolishment of another commission. This is the Georgia State Indemnification Commission. They do reviews of various claims for loss. And the commissioner actually sits on that with the governor and a few other leaders in state government. So the Department of Administrative Services is now going to take over duties of that commission. So there will no longer be meetings that the commissioner needs to attend on that issue. Next slide. The next one I talked a little bit about during our last meeting. This is the school glucagon prescriptions. It allows schools in Georgia to now stock a supply of ready-to-use glucagon. There's language in there that has the department working with DOE on developing the rules and regulations for the implementation of this law. So we're already in the process of doing that and assisting in coming up with language. We also anticipate that, similar to the use of albuterol in schools, that some of our health directors may be called upon to administer or issue the prescriptions for the schools to be authorized to stock this in the school. For this is for diabetic events that occur in a school setting. Next slide. This next one impacts our EMS program. We currently collect ambulance fees, license fees from ambulance providers in the state. This law will repeal that annual license fee requirement. Currently, we don't retain any of those fees. They are transferred over to the Indigent Care Trust Fund, but we will no longer be required to collect that license fee. Next slide. The next one is the House Rural Development Council. It's reauthorization. They usually meet throughout the summer and the fall around the state, usually in rural areas, focusing on different issues that impact the state of Georgia. They typically do have a few meetings specific to healthcare needs. So that's something that we usually will track and are sometimes involved in presenting. So we will be watching out for those meetings this upcoming year. Next slide. Next one is Senate Bill 1. This was a bill from actually the year before that prohibits state and local governments from requiring proof of COVID vaccination in order to access government services. There was a sunset on that original law. I believe the original bill was Senate Bill 345. And it was supposed to sunset this year. This bill didn't change anything with the law, but did remove the sunset provision. So it will continue into perpetuity. Next slide. This next one is called AJ's Law. It's regarding epilepsy or seizure disorders for students, similar to students with diabetes that have a care plan while they're in school that is drafted with their physician and then on file with the school system, so they know how to react, warning signs, and what to do for these students while in the school setting. This is a very similar structure, but for students with epilepsy or seizure disorders, and allows them to submit an action plan for school personnel to follow if there is a seizure event while the student is at school. And we'll be working with DOE in the development of their policies for that. This next one is related to STD testing during pregnancy, Senate Bill 46. And I think this may have come up when we met Dr. Rodriguez about updating our regulations regarding Hep B and Hep C testing during pregnancy. We discovered that our regulations and Georgia law were not up to date as far as testing intervals during pregnancy for syphilis in particular. Because Georgia is a high burden syphilis state as far as our rates go, it's indicated that women should be tested upon delivery when they present at the delivery hospital. And that wasn't in our current regulations. There was an exception if they were tested earlier in the pregnancy. So this law brings Georgia law into the same standards as what CDC recommends as best practices in this space. And really just makes it a lot more clear. It took the law down from several lines and paragraphs down to like one or two. So this one did receive final passage and was signed by the governor. Next slide. The next one's our vaping bill. I've been talking about this one for a couple years, and now you won't hear me talk about it again because it was passed and signed into law. This was our agency bill. It brings the Smoke-Free Air Act into the 2023, now where vaping is a thing. This original law passed in 2005 before vaping ever existed. So now it'll treat vaping and traditional cigarette and tobacco smoking the same as far as locations where it's prohibited. Like you can't smoke in a government building or a daycare facility. Now you will also be prohibited from vaping in those same locations. Next slide. This next one, it seems to come up every year, but this will probably be the last year we talk about this again. There's a sunset provision on employers that they have to allow the use of sick leave for their employees to care for an immediate family member, not just themselves. There was a sunset, but that has now been repealed. So this benefit will extend for all state employees. Next slide. This next one will impact particularly the commissioner's office. This allows in a legal dispute, certain high-ranking members of government agencies that don't have personal knowledge of a legal dispute. Protective orders can be issued for them that they don't need to appear at depositions. This also applies to like CEOs of large corporations, but it would also apply to the commissioner. It also requires us to identify staff that can accept service of process for civil actions in the office, and there's specific days and times that they have to be on site in order to accept service of process on behalf of the agency. And that information will need to be posted on our website. Next slide. This bill is regarding prohibiting the use of certain social media platforms on state equipment. So GMO will actually be responsible for identifying those social media platforms that will be prohibited. And then our IT teams will have to work on the IT side to ensure that those items could not be downloaded on any of our state devices. Next slide. This next one is, and Will's going to talk about this a little bit more too when he talks about the budget, but this is something we're really thrilled about. Senate Bill 106, it creates two pilot programs. One is going to be run out of DPH. The other one's going to be run out of PCH. The first one is a pilot for home visiting for at-risk and underserved rural communities during pregnancy and early childhood. And the intention of this is to improve birth outcomes and address maternal and infant mortality and morbidity. And I think we can probably do a presentation on more details on this as we progress, but we did receive some funding from the legislature too in order to start up these pilots, and we're really excited about the opportunity that we have here. So I think that's a good topic actually for another board meeting.
We already talked about, Diana and I talked about it this morning, and I think there's just tremendous enthusiasm throughout the state. And although we're focusing on the highest risk counties, we also are going to be working with DCH. We hope to be able to work out a reimbursement strategy that will allow this to be sustainable even as we can move into other areas. So we're in the north and the south, but we'll give more information in the future. I do think that many of our board members have a real interest in this, as we're trying to address both not only maternal issues, but also infant outcome issues through these home visiting. So it's going to be medical and social, and addressing a much broader approach than we had in the past. It's very exciting, actually. I think will be a very creative and unique opportunity for us to set the stage to have a tremendous impact on maternal and infant health.
Yeah, And I think one other thing that I want to touch on with this is we've done a lot of work with our sister agencies to work on cross-agency collaboration and making sure that we're all communicating with each other on this effort, so that these families aren't kind of falling through the cracks or being worked with by multiple agencies and us not know. So that's something else that's a big focus of this, is working across the quote unquote silos that everyone talks about. The second piece of the pilot is a Department of Community Health pilot to provide coverage for remote maternal health clinical services for Medicaid recipients that meet certain eligibility criteria. And all of that will be determined by DCH, like who would be eligible and what sort of remote services would be covered. The intention is things like fetal heart monitoring and things like that through wearable medical technology that then connects to applications and things like that. So we're going to be working with DCH to collaborate on that as well, and really have these two pilots work together.
Can I say one more thing?
Yeah.
I'm not supposed to talk. I've been silenced, but you know, I just want to give a shout out to our sister agencies and my sister and brother commissioners, because every single commissioner of a health agency has met with us multiple times. And that's not just DCH, but also DFACS, because I think they recognize that if we do a really good job at identifying the highest risk mothers and babies, both physically, mentally, and socially, that we can really prevent many of the problems they are later working with years down the road. And so not only have they worked with us, but also Commissioner Tanner, with whom I met. Literally, he's the new DBHDD director or commissioner. I met with him within first 2 days of his tenure here. I think his head was spinning. But I said, we really want to do this home visiting, and we think this is going to make a difference. And we want to be able to refer to behavioral health services, so important in the community, substance abuse services. So we just have had tremendous and unprecedented, in my experience, support and input from the other departments as well. And I think this bodes well for positive outcomes for this work. So I just wanted to let you know that, and I look forward to having the opportunity to share that more with you, with the team.
Thanks, Dr. Freeman. Okay, next slide. This next one is Izzy's Law. It stemmed from a drowning incident that occurred in Augusta last summer, I believe, where a child drowned during a swimming lesson. So this legislation requires DPH to establish a model aquatic safety plan based on national best practice standards. And there's a handful of best practice standards out there as far as and the intention is for swim lessons. What's the safest way to do that, and class caps and things like that. So DPH is to establish this plan, and then every private swim instructor in the state must have a plan on file with them before providing swim lessons to any individual. So they can rely on the state model as their plan or tweak it as long as they meet those minimum qualifications. Next slide. This next one is related to well installation on private property. This impacts our environmental health team. It prohibits local governments from denying the installation of a new water well for a single family residence if they're on at least an acre of property. Next slide. And then this last one is related to any of our staff we have that serve in the clinical settings that are a doctorate level nurse or PA. It prohibits them from using the title doctor in a clinical setting without first explaining to the patient that they are either a PA or a nurse. They can let them know that they have a doctorate level and they can be referred to as doctor, but they're not a medical doctor. It requires them to have that conversation with the patient in a clinical setting. And those are all the direct impact bills from this year. If you guys have any questions, I'm happy to take them.
Thank you, Megan, for a concise, timely, and a very, very clear presentation. Any comments, questions? I guess if not, we'll leave the past behind and go to the future with Mr. Bell.
Good afternoon, everyone. My name is Will Bell, and I'm the Chief Financial Officer here at DPH. On May 5th, 2023, Governor Kemp signed HB 19, the FY24 Appropriations Act, which provides a total of $32.4 billion in state funds to Georgia state government from July 1st, 2023 through June 30th, 2024. Over the next several slides, I'll provide a summary and highlights of DPH's state appropriations for the next fiscal year. And Frederick, you can go to the next slide. So this pie chart breaks down DPH's total appropriation by funding source. In total, DPH's appropriation across all funding sources for FY24 totals $306.1 million. Of this total, around half are comprised of state funding sources such as state general funds, which are reflected in the blue pie piece and make up around 46% of our budget. Trauma care trust funds and tobacco settlement funds each make up around 2% of our budget and are reflected in the light green and yellow pie pieces respectively. And brain and spinal injury trust funds, which are in that small red pie piece and make up less than 1% of our budget. It's important to note that both trauma care trust funds and brain and spinal injury trust funds are budgeted solely with two of our attached agencies, the Georgia Trauma Care Network Commission and the Brain and Spinal Injury Trust Fund Commission. Next slide. This table represents DPH's budget broken down by program with a summary of changes in the FY24 budget. The far left-hand column represents each of DPH's program budgets. The column entitled Continuation Budget is DPH's FY23 base appropriation, which has a combined state general fund and tobacco settlement fund total of $362.5 million. Across all programs, DPH's FY24 budget represents a total increase among state general funds and tobacco settlement funds of around $13.5 million, bringing the agency's new base budget to $375.9 million reflected in that far right-hand column. On the next slide, I will highlight and provide background information of several items within DPH's FY24 appropriation. The first item I would like to highlight is $13.7 million for a $2,000 cost of living adjustment for all full-time benefit eligible state employees effective July 1st, 2023 to address agency recruitment and retention. It is important to note that this item not only impacts 1,000 state employees, but also impacts approximately 4,000 County Board of Health staff. In fact, around 88% of this total appropriation of $13.7 million is appropriated directly to county boards of health. The next item I would like to highlight is $1.7 million for a pilot program to provide home visiting in at-risk and underserved rural communities during pregnancy and early childhood to improve birth outcomes, reduce preterm deliveries, and decrease infant and maternal mortality. You heard Megan talk about this a couple of slides ago, but I just want to provide some additional background on this budget item specifically. The overall goals of the home visiting program are to increase healthy pregnancies, improve parenting skills, improve child health and development, strengthen family connectedness to community supports, and reduce childhood abuse and neglect. The pilot will provide a full spectrum of services to support families, including clinical services for pregnant women, clinical services for postpartum women, and links to resources and services. As mentioned previously, we work collaboratively with our sister agencies, including the Department of Human Services, the Department of Community Health, the Department of Early Care and Learning, the Department of Behavioral Health and Developmental Disabilities to develop a model that comprehensively addresses the needs of the family. This pilot will be implemented in 2 rural health districts, District 2, which is in Gainesville, and District 9-2, which is in Waycross. Specifically, this funding will provide 11 home visitors, 2 district coordinators, 1 DPH program manager, and travel and supplies within the lead counties in each public health district. The third item I'd like to highlight is $931,111 for the continued expansion of pre-exposure prophylaxis or PrEP services. As many of you know, Georgia continues to have one of the highest rates of new diagnoses of HIV infection among adults and adolescents in the United States. PrEP is a medication that is used by HIV negative individuals to prevent HIV. When used as prescribed, PrEP is extremely effective in preventing transmission. Despite these benefits, however, PrEP continues to be underutilized, particularly in southern states with high incidence of HIV transmission, including in Georgia. As early as 2015, county health departments and other community public health clinics began establishing PrEP clinics across Georgia. Currently, varying levels of PrEP services are available at health departments in most public health districts. However, there are still several districts that do not offer PrEP services in county health department settings. These funds will be to fund PrEP services in these health districts. Prior to this service expansion, HB 290 of the 2019 legislative session enabled approximately $189,000 in state general funds to support a 3-year PrEP pilot program in the Rome district and in the Gainesville district. Although PrEP services were established in these districts during the pilot, the outcomes of the pilot were limited partly because of service disruptions related to the COVID pandemic, lack of support for dedicated staff to ensure sustained PrEP uptake, and connections to wraparound services. With these additional funds, a total of $1.1 million in state general funds will go toward PrEP navigators and nurses, patient and provider awareness campaigns, and routine clinical laboratory testing required for patients taking PrEP. The fourth and final item that I would like to highlight in the FY24 budget is $975,000 in general obligation bonds to fund major maintenance, renovations, and repairs at the Georgia Public Health Labs in Decatur and Waycross. The Georgia Public Health Laboratory, or GPHL, provides clinical and emergency response laboratory testing for DPH and has an essential statewide impact, providing lab services to county health departments and public health districts, hospitals and physicians, as well as to federal, state, and local law enforcement agencies. As laboratory testing methodologies have evolved to more advanced molecular and automated methods, the overall footprint of GPHL must also evolve to support these advances in operations and technologies. To address these issues, DPH was awarded one-time federal epidemiology and laboratory capacity for infectious diseases construction funding. However, state investment of an additional $975,000 is also required for furniture, fixtures, and equipment to support the planned GPHL expansion at the Decatur facility and maintenance, repair, and renovations to support existing spaces at GPHL in both Decatur and Waycross. Prior to transitioning to seeking your approval for the bond sale resolution for these bonds, I just wanted to pause to see if Dr. Toomey had any final comments about the budget or if you have any questions.
Mr. Bell, that was also very clear, and you seamlessly snuck us into the next agenda item where the board gets to exercise its muscles for necessary approval.
With that, we'll transition into the bond sale resolution. Before we move into the resolution itself, I wanted to provide just a little bit more background information on the two GPHL facilities on the next slide. The picture on the left-hand side reflects the Decatur facility, which was established in 1997 and represents the primary site for GPHL laboratory operations. The picture on the right-hand side is the Waycross facility, which was established in 2007 and supplements GPHL work while also supporting certain lab functions in South Georgia. The Waycross lab also serves as a critical backup for continuity of operations in an emergency should the Decatur facility become inoperable. Next slide. Prior to the board meeting, I provided a packet to you including this detailed information, but in summary, HB 19 of the which is the 2024 Appropriations Act, which we just reviewed, included $975,000 in general obligation bonds to fund major maintenance, renovations, and repairs at the GPHL facility in Decatur and Waycross. Following projects will be funded with the FY24 bonds: furniture, fixtures, and equipment indicator, carpet replacement indicator, and mechanical upgrades such as water leak repairs, a compressor replacement, backflow preventers for a humidifier, refrigerant leak repairs, and other minor repairs to the Waycross lab. The bond sale resolution serves as DPH's formal request to the Georgia State Financing and Investment Commission to include our bonds as part of the upcoming sale on June 21st, 2023. The bond sale resolution also serves as our affirmation that we will utilize these bonds in a manner compliant with state policies and procedures. Please note that this resolution must be approved prior to June 21st, 2023. At this time, I'll be happy to answer any questions, but I would appreciate the approval of this routine resolution.
Are there any questions for Mr. Bell? So do we have a proposal to approve the bond? Or could someone make a proposal?
So moved.
Second, okay,
Okay.
okay, all in favor?
All in favor?
Aye.
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 Mr. Bell, you're an outstanding
Mr. Bell,
salesman. And this is very important, and obviously it's a fairly small match for a large amount of federal funds, which were competitively awarded. They weren't just routinely given to everybody. So congratulations also on the receipt of the federal funds and the enhancement of the laboratories, which I think the COVID pandemic showed us how important to have molecular capacities in a rapid manner is. So congratulations to all. Dr. Toomey.
Yes, could I just acknowledge Dr. Parat, who's here coughing with me today?
So sorry, asthma gets me.
No, and Dr. Parat is acting director of the lab, and she largely carried the ball for this along with Dr. Millman. And so just many congratulations. This is very exciting. And I know that we have met at the lab before COVID actually, but I would hope that we can go sometime in the not too distant future again to have a board meeting there and to see the construction, because it's really quite impressive what's happening there. And so that's a proposal for the future.
Dr. Toomey, the mic is yours still.
Oh, I think the mic should be yours because you've got a better voice than I do now.
Well, then I guess I would just say congratulations to the state. And I'd also like to acknowledge how important it is to get the cost of living increase for public health employees. And I think that was in part, of course, due to the surplus in the state, but it was also in part due to the recognition during the COVID pandemic of how underpaid many public health employees were. So congratulations, Dr. Toomey.
No, I think, can I just say, I said I wouldn't talk, but now I'm talking. I mean, I have to acknowledge again, Mr. Bell and I kind of worked the floor on the budget increases of last year and this year, and just reinforcing how important. I guess one of the things that bothers me terribly is that although the violence against healthcare workers was acknowledged for workers in hospitals and other healthcare facilities, the violence against public health workers was not recognized by the General Assembly. And I'm hoping we can do that next year. Because that's something that, we experienced, we saw, we had our own vaccinators that were attacked, and it just really was difficult. And within that context, I think we were able to make the case how important it was to increase our ability to bring on nurses and others. So anyways, I want to acknowledge Will's role. I mean, Mr. Bale's role in making that happen, because his smooth talk that you heard today, can work wonders at the General Assembly as well.
So congratulations to all. Do we have a motion to adjourn the meeting?
I have a, can I just,
Anybody move it?
So moved.
Second?
Second.
All in favor?
All in favor?
Well, enjoy the rest of the
Enjoy the
beginning of
rest
the
of
summer,
the
and we'll see you guys later.
And we'll see you guys later.